In Dallas, 8 police officers have now tested positive for the coronavirus, but at least one of them is back on the job now after recovering.
Joining us live with more on how the police department is dealing with the pandemic is Dallas Police Chief Reneé Hall. Good morning, Chief.
Good morning. How are you?
Doing well. So the officer is back on the job. How's he doing?
He's doing well. We were so blessed and happy to see him return healthy and strong and checking on the others. I heard you say 8 police officers, but it's 9, and we also have 2 civilians. So there's a total of 11 members of the Dallas Police Department that had tested positive. So we're just thankful that they're all doing fairly well, and we're looking for all of a healthy and safe return.
That's good.
Chief Hall, what changes have been made within the department to adjust to the coronavirus?
So very early on, when we started hearing conversation about COVID-19, we stopped all of our daily details. So the officers could practice social distancing and not be exposed any more than they had to be to either each other or anyone else. So no huddling for daily details. We provided all written correspondence and communicated via our open channel radios. We also made sure that we pushed out our DOORS program. That's our Dallas online reporting system, so that our lower priorities could be phoned in or made over the computer by our online system. Again, our officers are our highest priority, so we want to make sure that we minimize their level of exposure as much as we can. And so,
what about just interacting with the public? I mean, something as simple as if I get pulled over, is the officer going to come right up to my window?
So what we've provided our officers with is their PPE, their personal protection equipment, gloves, masks, hand sanitizer, Lysol wipes. And, of course, we've asked them to keep their distance. There's no need to walk straight up to a vehicle. We wouldn't do that even out of a pandemic. There's a certain level of distance that you keep for safety, and now we're fighting against COVID-19, so there's an even greater distance. Or in some instances, we may ask someone to get out of their car via our intercom that are in the vehicle. So we have multiple methods in place. We've even moved to, when we're responding to a house call, calling that individual and asking them to step out the house. And that's only if it's not a emergency situation where there's an assault or something taking place. But if at all possible, they can step out and interact with the officers on the outside of the home. We're doing those things as well. So taking all the necessary steps to ensure the safety of the officers and the community as a whole.
Are you seeing an increase in domestic violence calls?
So we have seen some. It's not a huge spike. When we look at numbers for our family violence calls overall in January, we were right around 1,100. In February, we went to about 980. And then in March, we went back up to 1,181. So just a slight increase. But what we know is that with this shelter in place, sometimes people are trapped with their abusers. And so in that space, we are making sure that we are communicating, putting out PSAs, flyers, using our platforms where we were interacting with our community in community meetings. We're doing those virtual, making sure we're pushing out on social media to, if you see something, say something, and if you hear something, say something. Oftentimes you may hear a dispute taking place next door or in an apartment complex, and sometimes we just, not get involved. So we're asking our residents to make sure that they're paying attention, that they call 911, asking that if you are a individual who has been abused, to make sure that you're contacting the shelter. Keep a shelter number close. Make sure you have someone that you can contact in the event that something happens. Communicate with the children if you need an escape plan. Devise a code word. So we're educating to that point to make sure that we are addressing these concerns. And our child abuse is the same way. We recognize that some of our cases come from our schools and our counselors, and right now we don't have either of those in place. So we have to, as a police department, work alongside of our service providers to make sure that people can get the help that they need.